Hello, everybody, and welcome. We'll give everyone just a minute to populate in from the waiting room and get started right at the top of the hour. Hello, and welcome to the American Ambulance Association Balance Billing Update webinar. We appreciate everyone taking the time out of their day to join us and listen in. This webinar is being recorded and will be available on demand on our website tomorrow. The slides were linked in the reminder email that went out about an hour ago, and I will also drop them into the chat box for download shortly. Please use the Q&A box located near the chat box to ask questions of our presenters. We will be monitoring the Q&A box throughout today's webinar and answer as many questions as we are able to. With that, I will turn it over to Ms. Jamie Pafford.
Good Monday morning, everybody. And as Sam said, thank you for joining us today for our ground ambulance balance billing update. I am Jamie Pafford. I'm the President-Elect of the American Ambulance Association. But since about 2019, I have been tasked with being the chairperson for our balance billing work group throughout the American Ambulance Association. So today I'm joined with Kathy Lester of Lester Health Law, and of course, Tristan North, our Senior Vice President of Government Affairs. You know, I do appreciate everyone jumping on the phone today because I realize Monday mornings and the ambulance business is when we find out what all happened over the weekend that somebody didn't tell us about. And so I know your time is valuable, but I do think that this webinar is valuable as well to let you know what's going on with our industry and with this process that's been set out before us. Our objectives today are going to just first, get a refresher from Kathy on the federal advisory committees. And you mind flipping the slide over, Sam? There we go. Get a refresher from Kathy on our federal advisory committees, and then do a deeper dive and review the No Surprises Act and how it was established with the Ground Ambulance Patient Billing Advisory Committee. The acronym we use is GAPBAC, and hopefully we won't have to say that long sentence anymore today, and we will refer to it as GAPBAC. We're going to look at a timeline of GAPBAC and how it will continue to move forward, and then in the end, what we should expect. And you know, our goal for the American Ambulance Association and through our president, Randy Strozik, is really to make sure that we're doing our best to keep everyone informed. We have numerous meetings during the week with several different work groups. And then I'll meet back on Tuesday every week just to continue to work to make sure that we have no surprises at the end of this committee's development of what they feel like should be the new NSA for ground ambulance service. So with that being said, Kathy, I want to turn it over to you and let's just talk about how this committee came about.
Thanks, Jamie. And it's great to be here and chat with all of you. These next two slides are a little heavy in terms of text, and you can read them at your leisure. But I did want to highlight a few points because what GAPBAC is a federal advisory committee. And this is a unique entity within the federal government that was created by Congress. The Federal Advisory Committee Act, or FACA, is what governs the general outline of how the advisory committee will work. And I'll go through those pieces. Then later in the presentation, Tristan will share with you a little more, because the second part of any advisory committee has to be the specific statutory instruction that oversees it. And that is what was part of the No Surprises Act for ground ambulances. But to look at the general requirements, and these are true for all federal advisory committees, they're established by the Congress to be used by the Congress in making decisions, as is the case with the GAPBAC, the president, or the executive agencies. And again, we have three agencies that oversee us in terms of the No Surprises Act: the Department of Labor, the Department of Treasury, and the Department of Health and Human Services. And so they, along with the Congress, and as we know, this is part of the president's budget as well, the White House will be looking at the recommendations that come out of this. The goal of an advisory committee is to provide independent expert advice. And that's done through a few ways. First is just the charge, the general oversight that Congress gives. It's sort of this checklist that they need to be providing public advice. It needs to be open source, transparent, in other words, and available to the public. They also need to follow some just basic good governance procedures, such as following their cost controls, keeping good records. So you will see that there is a website housed through the Centers for Medicare and Medicaid Services, the folks who run the Medicare program, that provides you with background and transcripts and the slides that are part of the public process for this meeting. The General Services Administration actually oversees the management of these committees. Now, in our case, you'll see a lot of interaction with the federal departments, and that's great. But it is the GSA, which is sort of this more independent body that a lot of folks don't really engage with very often, that is responsible for making sure the committees follow their rules. Members are an important part of the committee. Oh, if you can go back one more slide, thanks. Members are an important part of this committee, and Tristan will talk about this in detail in a moment, but they come from various walks of life, industry, regions of the country. That's because the goal is to have a balanced point of view. And so members have different levels of expertise that they possess, different professional skills that are required. And so it's a combination of meeting these general requirements and then the more specific requirements that were part of the authorizing statute for the GAPBAC that determined who was selected. You may recall, a year or so ago, there was a call for nominations. Those nominations went forward and there were announced in the Federal Register the members of the committee. If you can go to the next slide. So I just wanted to drill down a little more on what does it mean to have this advisory committee. So we talked about the statutory requirements and its governance, but it's really important to remember that an advisory committee does not make decisions on their own. They're advisory only. And so they can provide recommendations, they can talk about things usually within their scope, sometimes they'll go outside of it, but all they're doing is making a recommendation. That recommendation comes in the form of a report. And in our case, that report is going to go to the tri-departments and it will also go to members of Congress. And the goal of that report is to make recommendations of regulatory or legislative changes that would need to happen, in our case, with regard to balance billing requirements. But Congress or the administration has to act before those recommendations become law. They will be reviewed by the committees of jurisdiction on the Hill, as well as by the departments. And so if the Congress determines that these are recommendations that they want to move forward, they will still have to go through the legislative process. There's no shortcut here. And so the goal at the end of the day for the committee is to put together that ideal set of policies that will work and that can be moved forward into law. So with that, I'm going to turn it back to Jamie.
Well, it is not by chance that we were not included in the original NSA Act, because we worked hard to ensure that we could protect our industry as a whole. And exactly what Kathy just laid out was one of our solutions as the American Ambulance Association, is to push this to an advisory committee. So we appreciate that opportunity that we were given. But one of the things that we were able to do as we were advocating on Capitol Hill was just continue to educate and make the point that no matter what, when you call 911 anywhere in the country, an ambulance will come. And during one of our meetings, I can remember one of the congressmen stating, he says, "Oh yeah, we love our ambulance folks. We've got to have our ambulance people in our communities." And he said, I was thinking the other day, they're just like the light switch. When you turn it on, you expect and call 911, you expect an ambulance to be there, just like you expect the lights to come on in your home when you flip the switch. And immediately, I don't know how, but immediately it came to me as like, well, yes, Congressman, that sounds good. But the difference is if you don't pay your light bill, The lights sometimes won't come on, but yet when you call 911 and ask for an ambulance, we're always there, regardless of your ability to pay. And that's why we were in his office that day, was to talk about that. And so it was a perfect segue to just continue to educate Congress on why we are unique and why different from other providers, and why they needed to make sure that they exempted us from the first NSA and took a closer look at what would fit our industry. You know, it's obvious that we want to help protect the patients as an industry, but we are forced into balanced billing situations because of insurance companies' practices that we have no control over. We were able to educate Congress and let them know that if they get surprise billing wrong for the ambulance industry, our healthcare safety net could disappear in many, many communities. And they listened and they heard us. And that's why we're at where we are today. Next slide, please. So you guys know I'm preaching to the choir right now. You know, insurers do not like negotiating with ambulance suppliers and providers because we are such a very, very minute makeup of what they do. You know, usually they offer one rate regardless if you're in network or out of network. And most of the times those rates are below Medicare allowables, which Congress already realizes that are inadequate, and we continue to work on that front to get those rates. You know, many of them refuse to negotiate even when they're required to by law. And a lot of small services just accept the rates as they are because they have the risk of, you know, if they argue, they're not going to be able to process the check and make their payroll or pay their bills, as well as they just don't have the resources to actually to fight the claim one by one. You know, this usually results in most of our providers being out of network. You know, we've seen many reports, and the latest was that about 85% of emergency claims are considered out of network. You know, this have reports of the surprise billing establishment plans are not reimbursing us properly. And then there's a big question about the rate of actual surprise billing claims. It's just unknown. And I think this has been our biggest challenge as the American Ambulance Association is throughout this whole process is the lack of information on ground ambulance services. It's been very difficult to come by when we talk about state laws and regulations throughout the country and pulling those things together. Everything is so specific to EMS and then sometimes very specific to our region or our state. Just kind of a fun sidebar here. It's not fun, it's just real. And it paints this perfect picture. Prior to 2022, Arkansas did not have an ambulance network. We were not allowed, nor did we have an ambulance network throughout our state. We weren't afforded that benefit. We were just all out of network providers. And this has been one of the examples that the American Ambulance Association has been able to push forward as we collect information of what's going on around our country and how ambulance providers are treated differently from other suppliers and providers when it comes to our payments from insurance companies. You know, with that being said, I think we've been able to paint a picture to Congress to help them seek answers to several of our questions and policy concerns that we have. And Kathy, if you don't mind going over a few of those.
Sure. So if you can go to the next slide. So, you know, in the NSA, what Congress was trying to do was to take patients out of the middle where they thought they had coverage and they thought they had signed up for an in-network provider, only to find that after a surgery, the anesthesiologist, for example, was really out of network. And so they had a bill that they hadn't anticipated, thus the surprise. But when it came to ground ambulance, it really wasn't clear. You know, you'll hear a lot of numbers tossed around about the potential of balance bills. All that means is the difference between what the charges were from the ground ambulance service to the private insurer that were not paid. It's not shocking that 85% of claims that are out of network are at risk for a balance bill because the insurers, as you all know, are simply not covering the charges. And so that led Congress, though, to take a step back. And unlike areas where there are stronger networks, they decided that they wanted to do a deeper dive, and that's how the advisory committee came about. So there were really 4 types of questions that Congress was asking. First is about state and local oversight. Unlike other providers, ground ambulance services, as you know, are highly regulated, not just in terms of licensing, but in the services you provide, and in many, many cases, the rates you're allowed to charge, what you can do and when you can do it. And so Congress did not want to get into the middle of this. Under the US Constitution, the 10th Amendment leaves all powers that are not expressly stated in the US Constitution to the states, and the states have their own constitutions, which can do the same thing for local governments. And so for Congress to get into the middle of that without understanding it better would really threaten the sovereignty of the states and our federalist society. So this was a really important point of what they wanted to understand better before wading into this area. The second thing was cost. As Jamie's already mentioned, Congress knows that the Medicare rates, which serve as the basis for the vast number of patients who ground ambulance services are provided to, are just really not known. When the current fee schedule was put together, it was not done on a cost basis. It was taking a pot of money and dividing it in a new way. And so Congress, several years ago, actually put together a ground ambulance data collection system. And Jamie will talk a little about this more in a moment. But we just had the first round of data come in. And so Congress didn't want to go in and necessarily make a decision about what the right rate for service is, not only because of the state and local government, but because we were in the middle of this process for determining costs and being able to actually have a real conversation, ideally reform those Medicare payment systems, but it could also be very important for this discussion as well. The third thing they wanted to understand is really what is a surprise bill in the context of ground ambulance services. This is very different than other types of provider groups. Some states we know require certain billing practices. In most cases, right, you don't have a chance to ask even what a patient's insurance is. I mean, even an emergency room in the hospital gets that information in a way that ground ambulances do not. So Congress really wanted to just understand what the scope would be and how those terms should be defined, even the basic concept of what is a ground ambulance service. And the fourth set of questions were really important. Congress concluded that for other provider groups, those provider groups had market power that dominated that of the insurance company. I don't think anyone on this phone would agree that that's even remotely possible in the ground ambulance situation. And that is for a lot of reasons, but the most prominent is, of course, that especially to the extent you're having the 911 or an equivalent contract, that you must provide those services. That isn't always true for other providers. And so you have to understand how the market dynamics then turn and put the insurance company in the power seat, because they know, and this is why there are so few networks, in-network providers, that you have to provide the services and then you bill. And if they don't pay you, you still provided those services, as Jamie said. So these are the 4 questions that the advisory committee is taking up that the Congress wanted answers to. And if you can go to the next slide, you can see how these questions really go at the heart of the No Surprises Act. So there are 4 major concepts, right, within the No Surprises Act. There's a prohibition on balance billing generally. That, if we were added into it, assumes that you bill the same way hospitals or physicians or other specialists are billing, and that's just not the case. So that provision would have to be rewritten and tailored to address ground ambulance needs. Then there's the amount paid. The statute actually sets out rules that provide protections to providers on the amount that's being paid. Those protections are grounded in what's called the qualified payment amount, or the QPA. That is the median in-network rate. But if you have 85% of ground ambulance services not in network, that in-network rate formula simply won't work. It is also not clear how that would interfere with state and local sovereignty issues that we discussed earlier. So the QPA, as currently defined, is not appropriate. And so the amount paid wouldn't make a lot of sense. So that would have to be revised. Then there's the arbitration process, right? If you can't agree and you're in the No Surprises Act between the insurer and the provider, one of the parties can ask for arbitration, which is the IDR process. There are lots of issues there, and I'm not going to go into all of them today. But just at the beginning of this year, the fee for getting in, and this is true for both parties, went from $50 to $350 a claim. As we understand it from folks in the air ambulance world who have been dealing with this arbitration, they are not allowed to consider as a single claim the base rate and the mileage. They have to go in as separate claims. So what this means is for each claim that you would take to arbitration, you would have a $700 fee that you could not get back. But then when you look at work that has been done by independent think tanks and others in this area, the average balance billing amount for ground ambulance service can be anywhere from $200 to $400. So it doesn't even cover the cost. That's before the party has to pay the fee for the arbiter, which is on top of that $700. So the batching rules, the fee amount, and then the timelines just simply don't work and would have to be revised if you were going to have an arbitration system that applied to ground ambulance. The final piece around the provider protections, there are also other consumer protections related to financial protections and basic transparency protections would need to be tailored as well. So ideas like prompt pay, direct pay to the ground ambulance service, those are all really important and things that you would want to have. But there are other things like the co-payment protections for patients that are tied to the median in-network rate. So that wouldn't work unless you go in and revise that. So as you can see, this is a very shorthand version. There are lots of details I'm skipping over, but just on its face, the No Surprises Act, unless it is revised, will work. And that's the job of the advisory committee. So with that, I'm going to turn it over to Tristan to give you an overview of the advisory committee.
Thank you, Kathy. So as Kathy mentioned, I'll be providing an overview of the actual GAPBAC or GAPB. The two are used hand in hand to reference the Ground Ambulance and Patient Billing Advisory Committee. So if you see either one of those, we're talking about the same thing, as well as an overall time frame of the balance billing process, as well as the GAPBAC meetings. Next slide, please. So here's a list of the actual members of GAPBAC. They don't necessarily represent a specific organization. So as you'll see down the list, you'll see Sean Baird. While he is not technically representing the American Ambulance Association, obviously he is the immediate past president of the American Ambulance Association and a member of our executive committee, and obviously working towards the benefit of AAA members within the actions of the GAPBAC group. You'll also recognize probably several other names, and they fall into kind of different categories. You have Asbel Montez, who is actually the committee chairperson for the group. You then have a number of designees from the respective agencies with oversight and involvement within the committee, being from departments of labor, Treasury, and Health and Human Services, and then obviously also GAM from the EMS section of NHTSA. Then you have additional government types who are involved within the process. You have Suzanne Prentice up in New Hampshire, a state legislator there, representing the state insurance regulators. You also have, moving down, Peter Lawrence, who is the fire chief or deputy fire chief and head of EMS for, I believe it's Oceanside, California Fire Department, who is on the group. Then you have a number of folks, obviously, who are designated in representing the ground ambulance segments of the industry, being Ted Van Horn with GMR, and then Regina and Rhonda. And then you have a number of others who are filling in critical roles, such as Ritu, who's a member of the National Association of EMS Physicians. You have Gary Wingrove with Mayo Clinic in Minnesota, who's representing patient advocacy groups, as well as Patricia Kelmar of consumer advocacy groups and representing those interests as well. And then finally, you have Adam Beck, who is representing the insurers, and Ubami, who's also representing state and local governments. He's out of Ohio, and I believe a physician there. And then finally, you have Lauren Adler, who is actually with the Brookings Institute, who has been looking at balanced billing for all providers and suppliers of healthcare services over the years, and in particular of late, specifically on ground ambulance services, and is an additional representative that was added to the committee. Next slide, please. So what is the purpose of the committee, going back to what Kathy and Jamie were laying out as far as Congress wanting to meet different objectives with ground ambulance service providers and recognizing that we are unique in a number of different ways? But a lot of the charges obviously want to align with the other protections and for both providers as well as patients in coming up with an overall scope of addressing balanced billing. So basically 3 key areas regarding the disclosure of charges and fees for ground ambulance services that patients could become aware of, better informing consumers of insurance options for such services. As noted earlier, obviously with emergency 911, there aren't necessarily a number of different providers that you can select from, but the different options for insurance and covering different bills from different providers. And then last and most importantly, from a number of perspectives from Congress, as well as all of us, I'm sure, trying to reach a common ground, is removing the patient from the middle of balanced billing. And then once they kind of fulfill this charge, they're going to be making formal recommendations to the Secretaries of Labor, Health and Human Services, and then the Treasury, and then key committees of jurisdiction on Capitol Hill, being on the House side, Energy and Commerce, as well as Education and Labor, and the Ways and Means Committee. And then on the Senate side, it's the Health, Education, Labor, and Pensions Committee, or also known as the HELP Committee. And that will be critical because, as you'll see with the time frame, it's then up to Congress to act on the recommendations of the GAPBAC group. They do not in and of themselves, nor do any of the agencies, have the authority to just move forward with the recommendations. It will be up to Congress to legislate what direction they take with ground ambulance services and balanced billing, which gives us another opportunity for education once we see what comes out of the advisory committee in working with members of Congress as to what is actually implemented. But the committee must meet a number of recommendations within its final conclusions, looking at best practices, standards for preventing balanced billings, what direction states, local governments, and related entities can take with balanced billing that's consistent with current legal authorities and recommendations, and obviously the actual legislative options for Congress to prevent ground ambulance and patient billing, and obviously injecting our own philosophy into this, in addition to making sure that the patient is taking out of the middle, that insurers are adequately reimbursing ground ambulance services within these recommendations, and that we are sustaining the nation's EMS systems moving forward. And in meetings that we've had with the White House, with members of Congress on this issue, really reinforcing those key points, that not just taking the patient out of the middle and protecting the patient, but also protecting ground ambulance service providers, as well as the EMS systems within each of the communities. Next slide, please. So, going to do a little backdating here of just how long we've been working on ground ambulance services, where we are now, and patient billing, and what we can expect timeline moving forward. So as Jamie pointed out, we as an organization, the American Ambulance Association, has been working in earnest since 2019 on ground ambulance services and patient billing. I would say probably the foundation was laid even before that. But by 2019, we were really on Capitol Hill, making our case, and ultimately, as Jamie and Kathy went over, excluded from the overall restrictions of balance billing, and instead looking at it through the Ground Ambulance and Patient Billing Advisory Committee. We did see at the end of 2020 passage of the No Surprises Act, which the GAPBAC language was included in, which then set in motion a legislative timeframe for the committee to address the issue. As many of you already know, they did not make that timeframe, but they technically had 90 days from passage of the No Surprises Act to form the committee. They then had a report, if you follow along that time frame, due by September of 2021, and then committee sign off by November of 2021. In reality, the group didn't come together until December of 2022. The first meeting after a delay in January wasn't the first public meeting, wasn't until May of 2023. We now have the committee through subcommittees, as Kathy pointed out, in two key areas moving forward for bringing something back to the larger advisory committee. That I believe CMS has stated as a confirmed date of August 16th, and then tentative date in October, November, final timeframe when they actually make those recommendations to Congress. So obviously that's at the very end of the congressional session. So unlikely that we'll see any activity in earnest in Congress addressing the issue with so little time, and then kind of focusing on, obviously, as we've seen with the debt ceiling, much higher priorities for the nation right now. But we should be looking at some sort of activity potentially next year. And we will obviously be calling on all of you to help ensure that we meet those three key objectives that I outlined: taking the patient out of the middle, making sure that there's adequate reimbursement for ground ambulance service providers, and that we are protecting the EMS systems of our communities. Next slide, please. And with that, I will turn it back over to Jamie.
I'm with you. Well, thank you, Tristan and Kathy. And kind of a round table here, you know, as we recap what we've just went over, expecting our next meeting on August 16th, there is a lot of discussion that is going on between associations, between experts, and a lot of data information gathering to make sure that we can make help folks make the most informed decision possibly for our industry. You know, in the meantime, we will continue to just educate and advise our EMS community of our position as the American Ambulance Association, along with Congress and others. One of the important things that we've started doing is we have outreach. We have a wonderful state association group. It's on base camp. We have a meeting, I think, I'm not going to say, I think it's September, in New York. They all run together, but we also will have a state association group meeting there in Vegas. If you're not signed up for that, that was a great meeting last year where we got to have some synergies of what's going on in our state. I'm focusing so much on the state part right now because many states have taken it upon themselves to protect their ambulance industry. Arkansas, Louisiana, and Texas just this last month ensured patient protections and protections of the ambulance providers by passing their QPA at 325% of Medicare for two of the states, and then utilizing the super rural base rate of 250% of that for the Arkansas solution. So some people are taking it in their own hands to make sure that they have protections regardless of what the federal government does. And we would encourage you to get involved and see what you can do through your state association and ensure that your eyes are wide open right now, folks. That's what we need to be doing. We need to be watching what's coming in on our EOBs, what is sticking out to you and your staff, and get that information where you're being denied for particular reasons, so that we have our workbook of issues that we have within the industry with the insurance companies and how they treat EMS, our services across the United States. I know Samantha is our go-to and has been the collector of all information and kind of keeping us straight with our dashboard. And I know you can send any of your information to info@ambulance.org if you have some information that you want to share of what you're doing with your state regulations that you might have going on moving forward, and keep us informed of what's going on at a state level. You know, our goal from the American Ambulance Association standpoint is to make sure that we can protect you, but also protect the patient and make sure that the ambulance responds. And part of that work has been ensuring the good data that we're reviewing and getting. And I know many of us had that May 31st deadline here just the other day to make sure that we got our cost data reporting into with our first and second round companies that were selected. I want to encourage you to make sure that you also are working with the American Ambulance Association with our AMBER tool to make sure that we're able to capture that information and that we're working with our experts to come up with our own formula of what those numbers should look like. So I know that there are some on calendar year, some are on different terms, and we'll be continuing to file your reporting. Make sure that if we can help you from the American Ambulance Association standpoint, that you reach out and allow us to do that. AMBER is an awesome tool, helps you to start collecting the information, getting it in the right format, and then helping you move on. I know that we have done dozens of face-to-face and webinars on our AMBER collection and our cost data reporting across the United States. And those have been very, very helpful, because bad information going in is only going to hurt us later on down the road. So we want to make sure if we can assist you, please reach out to do that. You know, it's really important for us to set some of the guardrails that Kathy and others have talked about. The things that, you know, it is about the payment at the end of the day. But what else can the American Ambulance Association do to help set those guardrails to know what the insurance industry needs to be doing for us, whether it is direct pay, you know, prompt pay, different things like that, are processes that we have to take into consideration for prior authorization. And then, you know, the monster in the room, we keep working to see if non-emergency or unscheduled transports will also be included, and how that will shake out across America as well. We have our eyes open to see what happens there. You know, I told you at the beginning of the hour that I know your Mondays are very valuable. It's a very tough day of the week for most of us. But we found it very, very important to come to you today and just give you a 10,000-foot flyby of what the GAPBAC process is looking like, and how we at the Ambulance Association are working to protect you, and what we should expect. And I think from what you should expect as an individual provider, you need to look close at your numbers. You need to know where your percentage is that's going to make you whole as possible from your Medicare allowable, and what percent of Medicare. Is it 150%? Is it 250%? Is it 350% Medicare? So you know at a moment's notice, just a click like that, of when you hear some of these numbers in these meetings, where do you fall, and where does your state fall? You know, those state protections are important right now. That's our backup plan from my standpoint and my states that we service. We've really been very actively pursuing another option. But the blessing here is that the American Ambulance Association is well poised and has put us in a position that we do get to go back to Congress. No matter what comes out of this committee, we have one more opportunity to voice our opinion to our lawmakers. And that is very valuable. And we see it continuing to move on into 2023 with that. You know, I'm a fast talker, and Kathy is the lawyer, and Tristan is the voice of reason. And so I'd just like to take a moment, and I know we're going to take some questions, but what did I leave out of, you know, what to expect? Kathy?
I think that was a well-rounded overview of where we are. I guess I would emphasize just a couple of things. One, you're going to hear a lot out of the advisory committee. Nothing is done, as I said, A, until the report comes out, and that won't be at the August meeting. B, that report has to be picked up and go through a normal process. On the regulatory side, that would be notice and comment rulemaking. But the agency may not have the statutory authority to do some of those things, and that would require legislation. And that, as you know, from the work we've done with the add-ons of the data collection system or other programs that impact ground ambulance, is not an easy path. So one of the things I think that is also important that Jamie said is that as you're working with your state and local governments, to find solutions there as well, because I think it is going to be a marathon, certainly not a sprint. And so just keep that in mind as you're listening to all of this. Share data, share examples and stories. It's really important for folks to know that while there's been a lot of drumbeat that we've been excluded, that ground ambulance folks are the heroes of this country, and that you've been put in the middle of an untenuous situation that goes to the very foundation of our system of government. And so how we can protect you and keep you out of the middle is just as important as protecting patients and keeping them out of the middle as well. So with that, Tristan, anything you would add?
I would just reinforce Jamie's point about find out where your margin is, right? What's your number? Because we're going to be looking at a number of different solutions, options across the board. So when this committee makes its recommendations, if we don't do it beforehand, we're going to make sure and reach out to AAA members to see where this falls in line for your organization. We can look at national data, and we've looked at data through AMBER, which is very helpful, as Jamie noted, that we definitely recommend folks provide your data there so we have a better idea of the impact on the industry. But no one is going to know your number or where you need to be except for you and your operation. So that is going to be critical for you to find out where you stand on what you need to see come out of the Ground Ambulance and Patient Billing Advisory Committee as a recommendation.
So there's a couple of questions in the chat and the Q&A, but I see Frank Gresh, our Oklahoma guy. He asked if there's a repository for examples of state legislations available. We do have one, and she's putting it in the chat right now, and it is on our Basecamp. And you can also check with Samantha as well to get copies of those. And so there are some Colorado, New York, different states have different things going, but you'll find that there. And then Amanda talks about the Biden administration. Do you see that question, Kathy, including in its budget vision? Can you answer that?
Sure. And so where we are today with that is much like an advisory committee, a president's budget is advisory to the Congress. And so nothing can really take effect before the Congress acts because, and this is our point of view of having talked about it with a lot of folks, because the No Surprises Act does create the advisory committee to address these questions, there isn't authority for the agencies to move forward on their own and simply add all a ground ambulance to the No Surprises Act. And it does undermine the view of and work of the committee. We have met with the three departments. We have met with the White House, along with our colleagues on the fire side and the EMT and paramedic professionals, raising concerns about what that one sentence suggests in terms of looking at the Ground Ambulance Advisory Committee. And so we can't guarantee change the language necessarily, but I think there is a strong sense of the Congress, particularly in the meetings I know Jamie and Randy and others have had with the committees of jurisdiction and the leadership in the House and the Senate, that we need to see what the committee says first. So it is a troubling sentence, but it is not self-executing, and it would really require Congress to step in. We have heard no signals that they are intending to do that at this point.
And I would just add, Kathy, I think from our call, as you noted last week with the Office of Domestic Policy within the White House, that they gave the indication that they were waiting for the recommendations for GAPBAC as well. So as Kathy noted, it was in the budget. There needs to be a lot that happens to the budget before it actually, those provisions become law. So I think we're in a pretty good position to see the committee be able to make its recommendations and Congress act on those recommendations, as opposed to anything being done within the administration beforehand.
So Albert, I see your comment about Colorado's 325 of Medicare. Yes, we absolutely looked at that when we were developing our language, and I look forward to the State Association Forum Sunday, June 25th at 1 p.m. at the MGM Grand to have some more discussion about that. Thank you, Rob Lawrence. He will be leading that discussion as well. And I know you have some QAs in the other side there. Let's see.
I just think with Mike Thomas, kind of following up on the question about the White House and being in the president's budget, no, none of the budgets that were set forth and none of the appropriations bills, as far as we know, include any spending cuts to offset other areas, or there have been no packages that would address that issue as well. Obviously, we saw the debt ceiling package go through. There was no reference or mention of it in there.
And Tim, I see your point about, advocate for the first dollar coverage. Give me any dollar, I want any dollars that they can send my way. Please send it at some point in time. But we will definitely put that on our next discussion list of how does that play into what we do and deductibles and things like that. Well, guys, I hope this was informative for you on this Monday, and we continue to move forward and work on your behalf from the American Ambulance Association standpoint. There's a lot of things going on. You get your newsletter weekly and just open it up and see what we have that's working for you or how you can plug in and get involved. Strength is in numbers. And we believe that, y'all are one of our greatest assets, being our members, and how we can help you and what you currently have going that's working in your state. We'd love to know about. So that info at ambulance.org is important for us to feed off of you. That's what we want to do, is to make you better and make our association and our industry better. So we look forward for the opportunity to work with you. And we hope that we'll see many of you in just a few weeks in Las Vegas at our annual conference and trade show that is got a lot going on, and I think will be a great, great time. Kathy, Tristan, anything else? Good deal. Well, good deal. Hey, you guys have a great Monday and have a great rest of your week. Thank you for joining us.
Thank you, everyone.